So, good day again. Today I'm going to perform the intramuscular injection. So, assist the client to a supine or lateral prone or sitting position depending on the chosen site. And if the target muscle is the gluteus medius or ventrogluteal site, have the client in the supine position, flex the knees, and in a lateral position, flex the upper leg, and in the prone position and go in. So obtain assistance in holding the uncooperative client, and if the client is uncooperative, we need the assistance in holding the client to prevent injury due to sudden movement. So explain the purpose of the medication and how it will help using language that the client can understand. Include relevant information about effects of the medication. So, good day, ma'am. I am your student nurse for today, and may I see your wristband? And please state your full name,
NG Fabrica,
your birth date,
July 30,
and your age.
20.
Okay, thank you, ma'am. So today, ma'am, I'll be injecting an insulin to you. It will regulate your blood and to blood sugar also. Blood sugar levels can reduce the risk of complication with your diabetes, and also can help you to feel better and more energy. Would that be okay with you, ma'am?
Yes.
Alright, so now selects and locates and cleanse the site, and select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. Okay, ma'am, can you So now, if injection are the frequent alternate sites, avoid using the same site twice in a row. So locate the exact site for the injection and apply clean gloves. So I have here a working gloves. Now I'm going to wear it. So clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 centimeters. Then discard. And prepares the syringe for injection. And before that, transfer and hold the swab between the third and fourth fingers of your non-dominant hand in the readiness for needle withdrawal, or position the swab on the client's skin above the intended site. So now prepares the syringe for injection. And then remove the needle cover and discard without contaminating the needle. So if using a preferred unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If those occur, wipe the medication of the needle with sterile. So now injects the medication using the Z-track technique. So uses the ulnar side of the non-dominant hand to pull the skin approximately 2 to 5 centimeters to the side under some circumstances, such as for so holding the syringe between the thumb and forefinger as if holding a pen, and then pierce the skin quickly and smoothly at a 90 angle. So holds the barrel of the syringe steady with your non-dominant hand, and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. So, okay. And then remove the needle. And then if blood appears in the syringe, withdraw the needle, discharge the syringe, and prepare a new injection. So if blood does not appear, inject the medication steadily and slowly, approximately 10 seconds. And then withdraw the needle. So withdraw the needle smoothly of the some angle of insertion and apply gentle pressure of the site with a dry sponge. And it is not necessary to massage the area at the site of the injection. And if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Because we must use dry sterile gauze because alcohol swab may cause pain. And activates the needle safety device or discard the uncapped needle and attach the syringe into the proper receptacle, and removes and discard gloves, and perform hand hygiene and document the relevant information, the time of the administration, drug name, dose and route, and the client's reactions, and assess the effectiveness and medication of the time it is expected to act. So, gonna remove the discard, and then sanitize your hand with an alcohol. And that's all for my presentation.